Hello, everyone, and welcome to today's episode of the American Academy of Research and Academics podcast. I am your host, and today we are diving deep into a topic that's pivotal for medical graduates, especially international medical graduates, IMGs. How to find research fellowships. If you're a medical graduate aiming for residency in the United States, you've probably heard about research fellowships. They're an incredible way to boost your CV, gain U.S. clinical and academic exposure, and make meaningful connections in the medical field. But how do you actually get one? What's the process? What are the challenges? And most importantly, how do you stand out? That's what we're going to unpack in this episode, step by step. Grab a pen and paper, because I'm about to share insider tips, actionable advice, and some pro-level insights to help you land that coveted research position. Let's get started. Before we talk about the how, let's quickly address the why. Why should you even consider a research fellowship? Research fellowships are invaluable for several reasons. First, they strengthen your residency application, especially in competitive specialties like surgery, radiology, or dermatology. They show that you have a genuine interest in academic medicine and the intellectual rigor to back it up. Residency programs in the U.S. are extremely competitive, especially for IMG. Having a research fellowship on your CV demonstrates commitment to the field. If you're targeting programs in academic hubs, think big-name institutions like Johns Hopkins or the Mayo Clinic. Research experience can be a game changer. Second, a research fellowship is an incredible opportunity to build your professional network. These experiences not only enhance your CV, but also open doors to mentorship and long-term collaborations. In a research fellowship, you're not just a worker bee, you're part of a team. You'll attend department meetings, collaborate with other researchers, and meet professionals who could advocate for you when it's time to apply for residency. Publications are gold in the academic world. Even if you're not the first author on a study, having your name on a peer-reviewed paper shows that you're actively contributing to advancing medicine. Presenting at conferences, that's another feather in your cap. And lastly, it's a chance to develop transferable skills, critical thinking, data analysis, and scientific writing that will serve you well in your medical career. Now that we've covered the why, let's move to the good stuff, the how. A research fellowship is essentially a structured academic or clinical research role where you work under the mentorship of established physicians. These positions often involve contributing to research projects, publishing papers, presenting at conferences, and sometimes even assisting in grant writing or study design. They can range from short-term positions, lasting a few months, to long-term commitments spanning 1 to 2 years. Not all research fellowships are created equal. Depending on your goals, you'll need to identify the type that fits your needs. University-based fellowships. These are formal programs offered by universities or teaching hospitals. They often come with structured mentorship, access to state-of-the-art facilities, and a well-defined curriculum. Departmental fellowships. These are fellowships offered by a specific department within a hospital or medical school, such as cardiology, infectious diseases, or oncology. These fellowships are ideal if you already know your specialty of interest. Some focus purely on bench research. Think lab work with test tubes and pipettes, while others are more clinically oriented, involving chart reviews, data collection, and direct patient interaction. So the first thing to determine is what kind of research fellowship aligns with your career goals. Are you aiming for a highly academic program? Do you want to stay connected to clinical practice? All right, now let's talk about strategies. How do you actually find these research fellowships? Start early. Start your search at least 6 months before you plan to begin the fellowship. Why? Because applications often have rolling deadlines, and positions can fill up quickly. Leverage your network. Network, network, network. I cannot stress this enough. Networking is your secret weapon. Talk to professors, mentors, and colleagues. Let them know you're looking for a research fellowship. Often, opportunities aren't posted online. They're shared through word of mouth. Let's face it, they're not always advertised like regular jobs. For IMGs, alumni networks can be a goldmine. Reach out to graduates from your medical school who are now in the U.S. or other countries offering research positions. This is one of the most underrated yet effective strategies. Here's how to do it. Identify potential mentors by reading recent publications in your field of interest. Use PubMed or Google Scholar to find authors working on topics that resonate with you. This might feel intimidating, but it works. Write a concise, personalized email. Introduce yourself, mention why you're interested in their work, and attach your CV. Pro tip: always include a specific ask, like requesting a meeting to discuss potential opportunities. Always make the email personalized. Mention your previous research work and then mention a specific paper they've published and explain why it caught your attention. Websites like ResearchGate, LinkedIn, and Indeed often list research positions. You can also check the career pages of universities and teaching hospitals. Look for terms like research assistant, postdoctoral fellow, or clinical research fellow. Professional organizations join societies related to your field of interest, like the American College of Physicians, AC, or the American Heart Association, AHA. These organizations often have job boards, mentorship programs, and networking events that can help you discover hidden opportunities. Academic conferences are a treasure trove of networking opportunities. If you can attend in person, great. If not, virtual attendance can still connect you with key players in your field. Don't hesitate to introduce yourself to speakers or panelists and inquire about research opportunities. Platforms like Twitter and LinkedIn are being increasingly used by academics to share research updates and job openings. Follow program directors, PIs, and institutions that align with your interests. If you're currently doing a clinical rotation or observership, use this time wisely. Ask attending physicians or residents about ongoing research projects. Express your interest and offer to contribute. If you don't have research work or publications in your CV, it's difficult to get a research fellowship later on. Don't apply blindly. Tailor your CV and cover letter for each position. Highlight experiences that align with the PI work. If you're applying to multiple places, keep track of deadlines and follow up if you don't hear back within 2 weeks, okay? You've found a few opportunities. Now comes the next step: crafting a standout application. This includes your CV, cover letter, and sometimes even a personal statement. This is your chance to connect the dots for the hiring team. Explain why you're interested in their research and how your skills align with their needs. Remember to personalize it. Be concise, keep it to one page, end with a strong closing, expressing enthusiasm for the opportunity. Strong letters of recommendation can set you apart. If you've worked with professors or mentors in the past, don't hesitate to ask for their support. Make sure they know the specifics of the role you're applying for so they can tailor their letter accordingly. Now that you know where to look, let me share some insider tips to increase your chances of success. Be persistent but polite. If you don't hear back from a potential mentor or institution, follow up politely after a week or two. Sometimes emails get buried, and a gentle reminder can make all the difference. Polish your CV. Your CV should be concise, tailored, and error-free. Highlight any previous research experience, publications, or relevant coursework. If you don't have research experience, emphasize your eagerness to learn and your dedication to the field. Ace the interview. If you get invited for an interview, prepare thoroughly. Know the PI work inside out, and be ready to discuss how your skills and interests align with their projects. Be open to volunteer positions. Not all fellowships are paid, especially at the beginning. If you can afford it, consider volunteering to get your foot in the door. Once you prove your worth, many unpaid roles can transition into paid positions. Document everything. Keep a record of the projects you work on, your contributions, and any outcomes like publications or presentations. This will come in handy when updating your CV or applying for residency. Build long-term relationships. Even if you don't get the fellowship, maintain a positive rapport with the PI or institution. They might consider you for future opportunities or recommend you to colleagues. Let's be honest, finding a research fellowship isn't always a walk in the park, especially if you're an IMG. The process can feel overwhelming, and challenges like visa restrictions, limited connections, or financial barriers can make it seem even harder. But here's the good news. With the right strategies, you can overcome these hurdles and set yourself up for success. Let's break down these challenges and tackle them one by one. One of the biggest roadblocks for IMG is visa sponsorship. Many research fellowships in the U.S. require specific visa types, like the J1 or H1B. But don't worry, there are ways to navigate this. Understand the visa types. J1 visa. This is one of the most common visas for research fellows. It's typically sponsored by the host institution and allows you to participate in academic exchange programs. However, remember that J-1 visas often come with a 2-year home residency requirement after completion, unless you qualify for a waiver. H-1B visa. This work visa is more flexible for long-term employment, but can be harder to secure due to its competitive nature. How to find visa sponsoring institutions. Start with academic institutions. Most universities and teaching hospitals in the U.S. have an Office of International Students and Scholars, OIS. This office is your go-to resource for understanding visa requirements and ensuring your application aligns with institutional policies. Search for specific keywords. When researching positions, use terms like visa sponsorship available or J-1 research fellow in your search. Network with fellows in similar situations. Many fellows who've successfully navigated this process are happy to share advice. Join IMG forums and social media groups to connect with them. If you've identified a position that doesn't explicitly mention visa sponsorship, don't hesitate to ask the program coordinator or principal investigator, PI. Sometimes, institutions are willing to sponsor the right candidate but don't advertise it upfront. Be clear about your visa requirements early in the conversation to avoid any misunderstandings later.